Good day, and welcome to the WANA webinar series. Thank you for joining. Please welcome Lee Kellogg from Clubhouse International.
Hello, everyone, and welcome to the WANA webinar series. As Nikki said, I'm Lee Kellogg, and I'm with Clubhouse International, and I'm really grateful to be moderating today's webinar, which is titled Clubhouse Research: How to Expand and Communicate Our Impact. We have an excellent panel with us today who will provide us with some ideas on how to contribute to the growing knowledge base and how to share our existing Clubhouse research. As all of you connected with Clubhouse can attest to, member stories are very impactful and essential in helping the public understand the life-saving power of Clubhouses. However, sharing stories about the magic of Clubhouse is not enough on its own. We need everyone to help collect, evaluate, and share the data so we can provide the body of evidence that Clubhouse stakeholders need when they're making decisions about resources. Our first panelist, Joy Agner, a professor from the University of Southern California, will walk us through the Clubhouse Impact Report and shareable slide deck that she and her team created specifically to help us in getting that evidence out there. It is really an excellent resource available to all of you through the Clubhouse International portal. If you haven't already checked it out, please check it out. Immediately following Joy, we will share a video of our friends at Sheldon Clubhouse explaining how they customized the impact slide deck for use in their community. So let's get started with Joy.
Hi, everyone. Thank you so much for having me. Thank you, Lee. As Lee mentioned, I'm an assistant professor of occupational science and occupational therapy at the University of Southern California. So yeah, I'm so excited to share this new tool that we created. We're calling it a report, but really it's a series of tools for Clubhouses to utilize the best available research. So I created this with two students of mine, Yongxi Wang and Elizabeth Bao, both in the Occupational Science and Therapy Division at USC. And my involvement with Clubhouses started when I was an OT student back in 2013 at Threshold Clubhouse. And then during my doctoral degree, I had the opportunity to work with amazing clubhouses in Hawaii. And now I'm working with a clubhouse here in Hollywood and also in Michigan. And through these experiences, I've heard consistently from staff and even from some members that there needs to be more research. We need more research to advocate for the model. If you could go back one slide. And that might be true. There are gaps in the existing research, but there's also a lot of compelling research out there that is, not always the easiest to find and not always the easiest to present. So what we wanted to do was make this research more usable to the Clubhouse community. So we released this set of tools in March, and since we've had about 240 people access it, primarily staff, 60% staff, followed by what we're calling Other Advocate. This is a mix of advisory board members, coalition members, administrators, researchers, and other health professionals, and then also members. Members are accessing this set of tools, which I think is awesome as well. So when people access this slide deck, we ask them some questions about their intended use and also about their some challenges that they've had accessing research in the past and what they'd like to see in the future. So within this group so far, the primary ideas they have for using this slide deck and other set of tools is educating organizations or providers about the Clubhouse model and its impacts, seeking funding, recruiting new members, and advocating for a new Clubhouse. There are also a couple people who are planning research studies, which is great. Some of the challenges that they've reported accessing research, it differs by group, but there were challenges reported for the majority of the participants who've accessed the Clubhouse Impact Report. So when you look at these bars, the green is members, The yellow is other advocates, the blue is staff, and then there's an average total on the far right. For members, the biggest barrier was lack of knowledge about how to access research. Where do you even find it? Where do you go to find actual studies that are reliable and that can be reported to an external audience? And then once people know where to find it, a lot of times they can't access it because of paywalls. Journals have paywalls that prevent people without library access to actually get to some of the research that's out there. And then once I found it, there was difficulty understanding the research. How do we make sense of this jargon, of all of this text, and then difficulty summarizing it, getting to that bottom line of what is the single most important thing here that we can communicate to others. Takes a lot of time and a lot of thought. So we wanted to help overcome a lot of those barriers, as many as possible, to actually utilize the research that's available. So our first step in this process was finding what we considered to be the most rigorous Clubhouse research. So we only included peer-reviewed studies that have been published in journals. We included longitudinal studies. There were 3 longitudinal studies, meaning they happen over time. They look at Clubhouse impact over time. There were 8 comparison studies, so looking at Clubhouse model in comparison to another model, such as perhaps another peer support model, a different type of psychosocial rehabilitation, day centers, sometimes psychoeducation. And then there were 4 randomized controlled trials, which in the research community is sort of the gold standard of considering efficacy. So what that means is that people were randomized into one type of program or another, and that they were followed over time. So there's both the element of comparison, the element of longitudinality, and then also people are randomized into these different groups. So that tries to control for the argument that, oh, people who are more well just go to Clubhouse to begin with. These studies were mostly located in the United States. There were 10 from the United States, although Canada, China, South Korea, and France were also represented. So once we found these studies, the next step, and perhaps the biggest challenge, was to pull out all of the information and put it into some sort of cohesive narrative. So every study uses different measures. They're asking different questions. There are different nuances about the population. And we know that most people really aren't interested in most of those details, and they don't have time to wade through it or make sense of it. For people who are, we have this summary table available within the set of tools that we created. So if you want to look at those details, you can. But what we did was we abstracted all the information, meaning we pulled it out, we grouped it by themes, and then we created sort of a cohesive story or narrative, which we called the Clubhouse Impact Theory of Change. So we organized these domains or constructs, some of the different things that these studies addressed, by what we anticipated would be some of the nearer term outcomes, and then moving on to more long-term outcomes. I will say that this is our concept of how this might happen, but there haven't been any studies to date that actually look at this over time and see what are some of the early changes that happen among members, and then what are some of the longer term changes. For the most part, these things were examined in isolation, or there were a couple pieces from different domains, but not really considered as a cohesive whole. So in this theory of change, we started with social functioning, improved social connection, then increased employment, access and utilization of employment programs and permanent employment, increased belief in oneself. So this is like improved self-efficacy, self-esteem, starting to think about one's own capability differently, reduced stigma, improved physical health, improved quality of life, reduced psychiatric symptoms, and then at the far end, reduced hospitalizations and cost of care. So for each of these domains, we wanted to make it as simple as possible to understand the bottom line of what was found in these different studies and what's really most compelling to an outside audience. So for example, in one of the slides on hospitalizations within this study, which was very comprehensive and had a lot of great information. We wanted to really boil it down. So this is what we found was one of the most compelling findings of this study, that members prior to enrollment were hospitalized at a much higher rate. So around 30% of the members had been hospitalized prior to starting their enrollment in Clubhouse. By the way, this is a study that was done in Canada. And then after 2 years of enrollment, that reduced from around 30% of members to around 15% of members. So we displayed that visually and then created just a simple, concrete explanation of what the finding was. Along with this, this visual display, we also included some example text. So if member or staff is presenting this and they're not really sure how to transition between slides or how to present this, or if they want more details, we added we tried to have as little text on the slide as possible to get the main point across, and then put the additional details in example text in the bottom. So you'll see when I presented this orally, I shared the actual numbers of the pre and post, which you can't see too well on the slide because we didn't want to bulk it up, but it is there in the example text. So if you want to add those additional details, you can. Additionally, we wanted to create opportunities to personalize the slide deck. Again and again, with my involvement with Clubhouses, I've really gotten the sense that there's unique identities. There's unique identities within the house. There's unique identities, of course, within the people. There are different styles, aesthetics, goals. There are partnerships that people might want to highlight. And yeah, so we wanted to add those stories or opportunities for those stories within the slide deck. So each domain in the theory of change has placeholders for customizable slides. And this is also a great opportunity to incorporate using the slide deck into the work order day. You could have, members interview other members or work on that customization as our friends at Sheldon House did. And you'll see a little bit more about that in the video. I'll just share as well that personal stories are extremely compelling. We like to believe that we're compelled by facts and data, and often that will get your foot in the door. But what really sticks with people is personal stories. That's what we remember the easiest. That's what really pulls on our heartstrings. So it's not only important from the aspect of, it being fun and interesting to include more personal stories in your presentations, but also it's effective. It really works to sort of stick in people's minds and make the case for Clubhouse. So this is just an example of a customizable slide placeholder. These are also completely removable. And as you see, there's some ideas for content as well as images, etc. So in addition to making this personalizable, we also wanted to create some diverse formats that you could use for different purposes and unique audiences. So we have the customizable slide deck, which is mostly what I've talked about and can be used in part or in full. You can use just a small section of it if you want. We also created a PDF that has all of the additional information, text, transitions, customizable pieces removed, and it's just the images presented in consecutively that could be shared as a flyer or a handout or attached to an email if you're reaching out to someone. We have single images of each of the slides. So say you're applying for funding for a new employment program and you only want to include some of the findings about employment outcomes compared to other services, you can just add that as an image in your report and put a note about Clubhouses being more effective, say, than another type of rehabilitation in improving employment outcomes for members. And then we also have the summary table. So for data nerds, for people who really want to know all those additional details, or maybe someone planning a study and they want to see what other measures have been used, that's available as well to examine and to, like I said, get more details about each of the studies. So this is what it looks like after you fill out the interest form. And it takes you and answer a few questions. it takes you to this Google Drive where you can just download any of this information. If you're not familiar with Google Drives, don't worry, it just looks like a normal folder, and then there's opportunities for download there. And none of this is editable on the Google Drive. It's just like a folder where you'll download the things that you want. So finally, we wanted to use this also to gather input from Clubhouse members and staff and advocates about what they would like to see in the future. When we were analyzing this, the existing research, we also saw gaps. What are things that we know Clubhouses are doing that are not represented in the existing evidence base? So I'll just highlight some of the things that came up in this. Clubhouse impact on community was a big one. Members and staff wanted us to examine what difference does a clubhouse make to people outside the house? Does it reduce stigma more broadly? Does it improve the health of the community, not only the members or even the staff, but the other people who live in the neighborhood? I thought that was really interesting and compelling. Factors influencing a successful clubhouse. So, you know, maybe what's the impact of staff structure or the size of the clubhouse or funding or how much consensus-based decision-making one clubhouse uses over another. There are many factors internal to Clubhouse that we could look and see what's really making a clubhouse thrive versus the ones that are struggling more. Healthcare costs was not the highest priority among members, but rose to the top for other advocates, and also was very important to staff. And of course, you know, within our context, it's important to consider funding, et cetera, and how the value add of clubhouses. Housing and homelessness was one of the top priorities among members. And as we know, this is a national crisis, and there are many clubhouses that are doing great work around supporting housing. And so, yep, that's also a gap that I would love to see addressed. Social connection. I was surprised by how few studies were included. There's a lot of great qualitative work that's been done on social connection, but not very much peer-reviewed research that looks at that over time or with a strong design in comparison to other settings. And then Clubhouse impact on members' family. Again, really important to look at factors not only impacting Clubhouse members, but how the broader impacts. And to my knowledge, there's only one qualitative study that looks at this so far. I thought these were great ideas and priorities, and hopefully can drive some of the future research. So I'll just close by saying thanks so much for you know, this time and opportunity to present. This is a QR code if you want to access the slide deck. So this takes you to an interest form that has some very simple permissions and requests, and then those questions that I presented on. The impact report is also available on the Clubhouse International website under research and also on the portal. So there are many ways to access it. I would ask that if you share this with others, also please send them this interest report, or I'm sorry, this interest form rather than the drive directly. That helps us track who's using it and also collect a little bit of information about what we should prioritize in the future. Next, we have a short video from our friends at Sheldon House, Tara and Lisa, who will share a little bit about how they modified this for use in their clubhouse.
Hi, everyone.
There we go.
I'm Tara Van Dyke. I'm working with Sheldon Clubhouse in West Michigan.
And I'm Lisa. I'm a member at the Sheldon Clubhouse in Grand Rapids, Michigan.
Yeah, super happy to be here. So we had the honor of working with Joy and her students as part of the data collection and research subcommittee, and helped give some feedback as this tool was developed. And then we're asked if we'd be interested in helping to customize it and give an example to other clubhouses of how to use it. So we went through that process and are going to share a little bit about what that was like for us and some of our sample slides here for you to see. We're going to share our screen here. Yeah, you want to kind of kick us off?
So one of the things that we wanted to do with the slide deck was to reflect on our clubhouse and make it customizable to our clubhouse using our colors, our graphics, our logos, and our photos.
Yeah, so this is our kind of one of our intro slides. It shows, yeah, our logo, one of our recent photos there. Click to the next one here. We took, just for the sake of this presentation, we took out most of a good amount of the slides. We're just going to highlight a few. This second one here, one of the things we also wanted to make sure that we did was share real stories of members utilizing the Clubhouse and how it's impacted them. So really helping that research come to life. This particular slide is connected to the research around social functioning. And so just making sure that, again, that the story with the data, that those things complemented each other well. We also want to make sure we had good diversity in the stories that we did tell. So we tried to be thoughtful in what we highlighted as we went through the slide deck.
So we wanted to include how Clubhouse is organized to achieve positive outcomes. In this slide, we wanted to highlight what employment supports that we offer within the Clubhouse, and we wanted to share who we currently partner with and possibly, one of our newest partners.
This slide here, actually, we're highlighting Lisa. One of the things that, again, we utilize, you can see our branding. So we had recently went through the process of rebrand. And so we had some graphics and colors that we identified as something that connected to our Clubhouse. And so utilizing that here. We also wanted to make sure our slides weren't too wordy. And so people weren't focused on the slide, but we're also listening to us as presenters. And so we try to use bullet points, short sentences and phrases, and then utilize the speaker notes as a way to capture what we hope to share on each slide.
So we wanted to make the slides easy to change and update. As everyone knows, memberships change, interests change, and so being highlighted in a presentation, we can make a change. Wanted to make it easily updated and where everybody would know how to just, go in there and change these up very quickly. If a member no longer wanted to be highlighted or we wanted to share a different story, we can easily change the slide deck for customization. And we can tell the story of a Clubhouse involvement without disclosing names or identifying details of a photo.
Yeah, and so the example on this slide here, if we wanted to quickly swap out and highlight a different member, we could just change that last sentence there and swap out a couple of photos. We want it to be something that it doesn't take too much work when we're ready to go out and present, that we can make those updates quickly and make this a really user-friendly tool for us. So yeah, so we've been really excited in being a part of this project. We also, for our Clubhouse, it's been nice to utilize bits and pieces of the slide deck. The whole slide deck to present it would to the right audience, it makes perfect sense. But for some audiences, decision makers, local community members, different parts of the slide deck will resonate more with them. And so recently we had an employment celebration where we shared some of the visuals and data around employment research. During our discovery tours, which we do monthly at our Clubhouse, we highlight some of more kind of the higher level Clubhouse research summary slides in that. And so it's a great tool. We've enjoyed being able to utilize it and really hope that Clubhouses all around the world will as well. So thanks for letting us be a part of it, and thanks for having us today.
All right. Thank you, Joy, and thank you to Lisa and Tara from Sheldon Clubhouse for sharing that. Really appreciate that. So for all of you Clubhouses that are joining us today, if you haven't already, I hope that you're going to customize and share those slides with your communities. And what a great week. It's the Clubhouse Week of Action to get going on that. So we're going to switch gears a little bit and introduce our next panelists. They are from Fountain House in the Academy of Glengary and the Academy of Bradenton. And they will start off with Fountain House sharing very exciting Beyond Treatment white paper that they put together that demonstrates some cost savings that Clubhouses could provide with some projections of large scale implementation. It's really very powerful. They will also be sharing some preliminary results on a loneliness study, which could lead to more potential research. And our friends from the academies will share how they're helping with that effort with gathering data in their clubhouse. So let's go ahead and turn it over to Fountain House.
Thank you, Lee. Hello, everyone. My name is Kevin Rice. I'm the Director of Research at Fountain House, and I'm joined by my colleague, Mohammad Usman, who is our Director of Advanced Analytics, and also overjoyed to be joined by our colleagues down in Florida with Vanessa and Patricia as well from Academy of Glengary and Academy of Bradenton. As Lee said, we're going to be talking about some of recent studies that we've been able to put out around how to quantify and calculate economic impact. And Mohammad's going to be leading us through that. And then we're going to then dive in a little bit deeper about what drives that economic impact. So we see that Clubhouses have that economic impact, and we're going to go into some recent research that we're doing, and we're going to be producing and sharing out around loneliness and how Clubhouses impact loneliness, and how we can frame the narrative of how Clubhouses impact loneliness in connection to how we drive cost savings, benefits for members, and really positively impacting the recovery and support of the communities and Clubhouses. To kick things off, we're going to be going into this economic impact analysis, though, and I'm going to hand it over to Mohammad to get us started. So Mohammad, please take it away.
Thanks, Kevin. Hi, everyone. So as Kevin indicated, Fountain House has done some extensive investigation and research to try to grapple with the economic implications of SMI. The slide before you indicates that only 20% of healthcare outcomes are actually driven by healthcare behavior. The remaining social determinants or environmental factors account for about 80% of those other costs. And this might be a statistic that you're broadly familiar with. So as part of our research to try to unearth and understand how costs are comprised of in the United States, it's important to situate our work in context, which is that you could see in the American context, 2/3 of all funding for healthcare is driven by treatment, whereas 1/3 is driven by the social supports, where almost nearly the inverse is true in other developed countries. And developed countries here refers to the OECD countries. So when constructing our economic model, which we've been working on for coming on 2 years, we tried to look at the existing array of research and data that's available that looks at the measures of mental health or healthcare costs, focusing specifically on SMIs. And we broke those costs out into 5 discrete categories as represented here. We have mental health, physical health, disabilities, criminal justice, productivity, which is an indirect measure such as wage loss, and then creating a dynamic model that's based on regression-based modeling to look at how those costs adjust relative to participation in a Clubhouse setting. So to further illustrate, we can see that there are 2 categories of costs. Direct costs, which include mental health care, physical health care, criminal justice system, public benefits, so direct resource allocations, and then indirect costs. These are costs associated with an inaction. So for instance, loss of productivity that may result, maybe a consequence of an SMI. So our economic model relies on these different variables to come up with a computation. And this computation can look at these 4 different variables, namely the number of years a given person has participated in a Clubhouse setting, the frequency of their attendance in a Clubhouse setting, 1 or more times per month, and you can granularly adjust that as necessary, the type of SMI, be it depression, bipolar disorder, schizophrenia, or an aggregate, and finally, the utilization of healthcare needs. And so here we have high utilizers of healthcare services, low utilizers, and then an average of those different variables. When we put those together, we get certain sort of interesting findings with respect to cost. Specifically, if we took a look at a non-Clubhouse person, assuming a constant conditions of baseline participation relative to a Clubhouse participant, we can see that a non-Clubhouse participant would have an aggregate cost of just under $61,000 a year. And these costs are comprised in the stack bar chart as shown of loss of productivity, physical healthcare costs, etc. When compared to a participant who is a member of a clubhouse for a similar period of time, that results in an almost $11,000 in savings in this computation. Now you might ask, well, how did you come up with these numbers? Again, these are based on known data that we've found with respect to literature that shows us the available cost for physical healthcare services. Then we've developed the economic model then uses formulas and regression-based modeling to come up with what those costs would be relative to participation in a clubhouse setting. And we have published on this, should you be interested in further reading up on the literature. And here's an illustration of this fact if we look at a high utilizer of healthcare services. So in that sense, such a person has a cost of just under $99,000. But if such a person was a clubhouse participant, the net savings of that clubhouse in this setting is just $22,610 of clubhouse participants. And so here we can see that the clubhouse setting provides a material economic savings. And these cost savings are diffuse, which is to say the implications are not necessarily borne on singularly the physical healthcare sector, et cetera, but across an array of different factors. But physical healthcare makes up a significant portion of where the savings are realized. Finally, if we took the consequences of this research and multiplied it by a significant, increase the participation of clubhouse members nationally, where we simply put 5% of all people living with an SMI were they to become clubhouse participants, we would observe an $8.5 billion a year annual savings in these aggregate societal costs as represented above, which is really a further illustration of the power and potency of clubhouse participation and what the clubhouse means, both to individuals and in raw economic terms.
Thank you, Mohammed. Really appreciate the review of the model. And just really want to highlight that since we've been able to do this economic modeling, sourcing from different things and research that looked at employment outcomes for clubhouse members versus non-clubhouse members, looking at hospitalization costs for clubhouse members versus non-clubhouse members, looking at all the array of variables that Mohammed listed, and being able to calculate that based upon standard engagement rates, length of membership, we are now able to really show, really based upon the research, and one that we can advance and continue as we get new research moving forward, a number of implications. And that there are fundamentally, when you just look at the cost of, as what we started with, the cost of what it takes to, that we spend on healthcare and how much of that actually goes to social supports in different areas, that we can see that comparatively for what gets invested in clubhouses, the impact of them, and from what you're seeing in the economic model, is incredibly large, especially for what is they're resourced with. And that these things largely are driven by a number of factors that usually don't go addressed or treated within typical treatment settings. And so just further highlighting the uniqueness of the Clubhouse's role and also their contribution to not only just the well-being and support of the community and lives of members, but also just that it just makes economic sense to have Clubhouses working and supporting within communities and working with members. And the last bullet point here before I have the link is that we really also want to support payment models that can make Clubhouses feel stable and sustainable, because we can see that if certain payment models are making Clubhouses disappear because they're not able to either meet certain metrics or standards, or they're kind of, they're on shaky grounds in terms of funding, that, we can advocate and support and talk to different policymakers, talk to different legislators around, look at the cost impact of Clubhouses now. Imagine if we invested in them, if we grew them, if we expanded them, and that's what that final graphic and figure of that $6.8 billion total effect is really meant to demonstrate. And so, we can have some confidence as Clubhouses around the economic impact that we can demonstrate, and we hope to kind of continue to advance that to help kind of people really share and motivate different stakeholders to become more interested in Clubhouses, not just based upon Clubhouses being something that people can get excited about just in terms of kind of community and belonging and relationships, but also that it's just fundamentally makes economic sense as well. So just adds another component to the conversation around the value of clubhouses. So we're going to transition and go into going into a little bit related topic, which is some research and work that we've been doing around loneliness. And then the question is, how do clubhouses have economic impact? Well, one of the ways that we've been drilling down further into that is not only that they have economic impact, but that likely that economic impact is being driven by our effect on loneliness and how we are able to decrease loneliness amongst our membership. So to kick things off, I do just want to highlight that when we talk about loneliness, it's distinct from social isolation. It's not just that you don't have access to social interactions or you're not able to build relationships. It's that even if you do have those, you can still feel lonely, that there isn't meaning or there isn't a sense of belonging amongst those interactions. So the definition that we usually operate with here at Fountain House is that loneliness is a distressing experience where individuals perceive a significant gap between their desired and actual social relationships, the types of relationships that people want or that they identify as ones that are meaningful to them. The other thing too is, we'll talk a little about this on the next slide, but is that loneliness also has a really outstanding impact on health. There's been a bevy of research over the past couple of decades that really linked loneliness to various types of risks around mortality and morbidity that have real cost impacts that are sometimes, in some studies, been made equivalent to smoking 15 cigarettes a day. And imagine the impact, if you kind of cut that out of certain lifestyles, if you're able to address loneliness and it's being compared to that, the impacts with health have been quite large. The other thing too is that with loneliness and why we're focusing in on it is not only is it because that Clubhouse is really zone in on community and belonging and building relationships, but it's also that we really see loneliness, the prevalence of it within our communities and members with histories of SMI being really profound. It's 2 to 3 times in some studies found to be higher in SMI populations. And some studies have even found that up to 80% of people with histories of a psychotic disorder feel lonely. And so the prevalence of loneliness in our communities can be really high if left unaddressed. This is a slide that I won't go through in too much detail, but it's just also highlight that loneliness is also part of the current conversation around how what existing healthcare systems have been doing may not be fully addressing the complex needs of persons with serious mental illness. And this was really highlighted in the recent Surgeon General report on the epidemic of loneliness that highlighted some of the things that I've already mentioned around the various health risks, the economic impacts that if loneliness goes unaddressed, how there's an interaction between if you're lonely and the increased likelihood of mental health risk with depression, anxiety, and other kind of feedback loops that if you are lonely, you'll exacerbate those conditions, and also how those conditions can exacerbate being lonely. And then also that there's been growing a need for increased research around the protective role of social connection. And as Joy pointed out earlier, this is something that people are highlighting, wanting to have more understanding around is the relationship of social ties and support networks and how they support people and rehabilitation and seeking the kind of lives that they want within the Clubhouse and elsewhere. So I'm going to give us a quick synopsis of the Fountain House analysis that we've done on a pre-post of loneliness. Go to the next slide. So what we do at Fountain House and what we're starting to do at some other Clubhouses as well is that we collect loneliness survey at the point of application, and then we do a follow-up at a later time, usually around 1 year to 2 years with folks. And we have been able to accumulate enough people within a pre-post match to take a look at, well, where were people at on their loneliness when they started Clubhouse, and where were people at afterwards? And we really wanted to take a look at this because, one, as we've seen a lot within the qualitative research, people identify having their loneliness addressed, their isolation addressed, and finding meaning and connection through the work order day in the Clubhouse is one of the primary experiences and motivations for utilizing the Clubhouse. So this really motivated us to start collecting this and using this as part of our standard operations of when we collect it at application, this 3-item loneliness scale, and then we follow up with it at a later time. I'll go into this detail, but this last bullet point on this slide, but it will have some more detail on the following slide, is that we have found that there's a significant reduction in loneliness, with over 56% of the members feeling less lonely at follow-up who were part of the cohort. Drilling down into the details a little bit further, I want to draw attention to that second bullet point is there is within the UCLA loneliness scale, if you're on, you have a total of 9 points that are possible. You have 3 questions, each scored at a rate of 1 to 3. If you score a 6 or more, you're considered to be lonely. If you score under that, you're considered not to be lonely. What we have found was that 73% of people who came into the Clubhouse identified as being actively lonely at that time. And at follow-up, that decreased to 57% in terms of the prevalence. So whereas the previous statistic said that 56% of people became less lonely, this is telling us of how many people moved actually past that threshold into not being lonely as defined by the measure. So there's a difference between how people progress on their loneliness and how people achieve past that threshold of being not lonely as well. So there's 2 different ways to kind of look at this. People might have different kind of journeys to achieving their loneliness impacts that may take different variables of time. But at this current follow-up, we see that there's 16% reduction in prevalence of loneliness. And that this was translated to that there was an average of overall of 22.5% decrease in overall loneliness for all the participants. And we were able to then take this overall decrease of 22.5% of loneliness for all the participants and link that with some other research that has talked about the relationship of lonely, if you are lonely, and if you have that as a feature, as a social history or part of your kind of health profile, that is highly linked with risk factors related to cardiovascular disease. We as in Mohammad, was actually able to then calculate based around if we are able to decrease loneliness prevalence and decrease the loneliness amount, how are we decreasing the risk factor of cardiovascular disease? And then we were also able to, from the literature, calculate, well, what's the cost of cardiovascular disease that we experience in the United States? And if we decrease that risk factor, we can then calculate how much does actually a decrease in the 1 point of loneliness translate into mitigating cardiovascular disease risk. So this was another way of us being able to quantify the impact, not just of the people becoming less lonely, but when they do become less lonely, that there's an economic framework in which we can associate that with. And what that then translated to is that for every point of reduction in the loneliness score, there was an associated estimated cost saving of $530. The details are about around the 400,000, and the total savings for every 1,000 members are listed here. But you can get more of those details and how we unpack that calculation within the longer white paper, which I have linked within the chat. Yes, about the loneliness scale, actually, Academy is going to be able to get to talk and share what the loneliness scale is here in just a sec. So with this analysis, we've been doing these pre-posts here at Fountain House, but we've also been supporting and working with other clubhouses to collect this information as well. And there's also a component that when we introduce these types of measures into the Clubhouse community, that there's an impact about how those are experienced in the community. Why are we doing this measure? Why am I being asked to fill out this questionnaire? What's the reasoning? Will I get to see some of the insights from it? And one of the things that we really wanted to highlight here is that when we start incorporating these methods into our Clubhouse communities, that they have an impact. And there's certain strategies to do that effectively, especially if we're trying to not kind of instill a clinical feeling or vibe to how we are engaging with our membership and how members are kind of understanding their relationship to the Clubhouse, just only based around numbers or something like that. So to speak a little bit more about how they've been adopting and utilizing the loneliness scale in their community, I'm going to hand it over to Vanessa and Patty at Academy at Glengary in Bradenton. Thank you.
Thank you so much, Kevin. So as Kevin pointed out, I'm Patty Haltinner. I'm the enrollment coordinator at the Academy. And the UCLA Loneliness Scale is the assessment tool we use to quantitatively assess the loneliness with a score of 6 or higher, indicating significant loneliness. So we have found at the Academy that the success or failure of a survey is entirely dependent upon the quality of our relationships with our members, the people completing our surveys. So therefore, we've incorporated the loneliness survey into our orientation schedule rather than with our membership application. And this way we feel that we've gotten to build a little bit of a rapport with our new member coming in, and that will assist with their interest in completing the survey with us. So we have surveyed 45 new members as of yesterday. We started in September of 2023, and we will continue the research for 1 year, and then we will resurvey these members and share that information with Kevin and Fountain House. So the scale is comprised of 3 questions that measure 3 dimensions of loneliness: relational connectedness, social connectedness, and self-perceived isolation.
Awesome, and I'm Vanessa here with the Academy at Bradenton. Thank you so much, Kevin, Mohammad, and also Patty. So the questions on this survey entail: how often do you feel a lack of companionship? How often do you feel left out? And how often do you feel isolated from others? And that's actually here on the slide deck in that image there. The scale uses 3 response categories, and those categories are hardly ever, some of the time, and often. And to score someone's answers, their responses should be coded as the following. So if someone, for instance, marks hardly ever, that receives a score of 1. If someone says some of the time, that is a score point of 2, and then often is a score point of 3. So that's kind of how we track the scores of our loneliness survey. And these scores for each individual question are then added together to give a possible score range of 3 to 9. With that being said, researchers in the past have grouped people who score 3 to 5 as not lonely and people who score 6 to 9 as lonely. And then I just wanted to share, one of our members, Justin G, was actually going to be joining us today. Unfortunately, he's under the weather and was unable to do so. However, he's been a big advocate and played a large role in just implementing the loneliness survey data here with us, and also collecting the data as well. So I'm going to go ahead and just read his member testimonial, if that's okay. And these are from Justin's words. So my name is Justin G, and I have been a member of the Academy since October 2023. I have learned as you age, it becomes harder to meet people and find a community to be a part of. I would describe loneliness as not having community, a sense of purpose, and lacking meaningful friendships. The Clubhouse is a forum to help members who feel lonely by engaging them in work, encouraging small talk to build rapport, and find their place in the community. I have a background in finance, and from a donor's perspective, loneliness is not a metric that is typically used. However, it's a metric various audiences can relate and connect to. Being a part of this data collection opportunity has given me a sense of engagement and an opportunity to use the skills I have and implement them into the work order day. I hope this survey will be helpful and impactful for others as it is to our Clubhouse. Thank you.
Okay, thank you. And then just some points that I know we're need to get the QA, but and go into the discussion. I think both Academy and Fountain House, when we reflected on presenting today, we thought that there was some reflection that the Clubhouse community has around measures in general, and the importance of being able to select our own measures and metrics. What do we think is important for us to measure about ourselves? Often Clubhouses are told what to measure by external funders or other resources, but being able to pick our own measures, I think is really important. And I hope that there's a larger conversation around things that go beyond loneliness, or whether or not people feel like loneliness is a relevant measure for the Clubhouse community to be collecting. And also that just we're entering into a landscape where a lot of people are wanting to see the impact of Clubhouse through not just how many people are engaging, but what are the achievements. And both Fountain House and Academy have gone through this experience where we're now expected to report out not just how many people are coming to the community, but what are the different outcomes that are being presented by the membership. And loneliness is one of those outcomes that we're hopeful will be representative and meeting those demands. But it's one that more and more clubhouses are facing around kind of the reports and expectations on different things. And then lastly, there was just evaluating effectiveness. We start taking measures, what makes a clubhouse effective, what happens when a clubhouse is not impacting loneliness? How do we address that? How do we think about that? What is that indicative of? Do we feel like that's different case by case? When we start bringing in measures like this, I think it brings a whole bevy of questions around standards and around, different types of approaches that we can take around thinking about the clubhouse and the movement in general and how we explain ourselves. So these were just some of our thoughts and reflections, and I look forward to discussing more broadly with the whole group. Thanks so much.
All right. Thank you, Kevin, Mohammad, Patty, and Vanessa, and a special thanks to Justin, who shared his thoughts with us today, too. So let's turn it right over to Nikki. We're kind of short on time here, and we want to get to your questions. So, excuse me. So, Nikki, you want to kick us off?
For those who have a question to ask, you could submit it in the Q&A panel on the right side of your screen. For Joy, the first one is for you. What exactly did you do to extract the data for the impact slide deck?
Yeah, so we didn't actually extract the data. We extracted the findings and the measures and the populations, et cetera, to try to find commonalities between the different studies, and then, like I said, report it in a way that's cohesive. So all of those details are available, and you can actually see how the data abstraction in the summary table that's in the slide deck, or not in the slide deck, I'm sorry, in the Google Drive.
Perfect. Our next question, how do we access the full article or source for the findings you have described?
So similarly, in that summary table, there's a link to each of the full studies. So if you want access to the whole paper, you can find it there. I'll also just share briefly that I don't know if people are familiar with Google Scholar, but it's just a different search engine. Instead of using Google, you use Google Scholar, and it only shows research findings. So you could just also go to Google Scholar and put in like Clubhouse hospitalizations, et cetera, to find, or Clubhouse loneliness if you want to find more studies.
Thank you. Our next question, what are the perceived weaknesses of the Clubhouse model as related to research?
Okay, that's a great question. Maybe we start with Fountain House and then get Joy's thoughts.
I mean, I don't know if I've always been of the side that there's just strengths with the way that we are able to conduct research at Clubhouses in the ways that we are not able to do it in any other type of setting. It's kind of like we're a living lab to a certain extent, and the people who it impacts the most, the membership, are often directly involved in the research. I think one of, something that someone might come back and say, well, sometimes the work takes longer because of that. But I once again, I don't think that's necessarily a weakness that's offset by those strengths. So actually, I think it's one of the hidden advantages of Clubhouses is that we're so conducive to be participating in research that we often don't give ourselves that credit. And I think it's thinking that I think that it's just kind of maybe believing that in ourselves is maybe the weakness. Is building up that narrative that we have that capacity is probably what I would say. I know that's kind of a non-answer, but I would say that's what our current weakness is just that confidence, that sense of that we have something really valuable here and to participate with. And I'd like us to lean more into that and to find our stride with that. So I'd say that's what I would see as our weakness, but just not realizing how many strengths there are that we have in the community to really bring to bear in the Clubhouse.
Thank you, Kev. And Joy, how about your thoughts?
Yeah, I love that perspective. I agree that also with like different mental health settings that I've worked with, Clubhouses are generally very open to and excited about doing research, which is unusual because they believe in the work that we're doing. So that's also, a huge strength. I would say I kind of agree with some of the things that have risen to the top for when we were asking, members and staff what they would like to see in future research in terms of, I would love to see, some of the broader impact on community, impact on family, factors influencing a successful clubhouse. I'm really interested in how much participation is going on, because some clubhouses are more engaging to their members, some clubhouses are less. So how can we improve that internally? But yeah, I agree. There's a lot of strong research out there already too.
Thank you. Other questions?
Yes. Our next question, what are the unique Clubhouse metrics that you would like to see more studies on?
Why don't we start with Joy on this one?
I'm really interested in reciprocity, and I think that working together, working side by side, to me, this is a key difference in Clubhouse. One of the main things that's very distinct from other, even psychosocial rehabilitation centers. It's like there's an opportunity for leadership among members and different roles that you don't see in other settings as much. And I would like to see that operationalized and compared to other settings that aren't using that model. So those key features of the inner workings of Clubhouse come out. And then, of course, social connection. I'd like to see more on physical health too. There's really poor physical health outcomes and housing outcomes among people with mental health conditions broadly, and that's fairly under-researched. And I think that Clubhouses are doing a lot of good work in that area as well.
And a couple of things that I would like to add in working with Joy. One of the things, one is as Joy mentioned in the interest questionnaire, getting from Clubhouses, what areas do you think we want to be looking at and need to be looking at? And you could see in her slides, there's a difference between what members were thinking about, what staff were thinking about, what others were thinking about. And the other part that I wanted to reference that Joy brought up was trying to get a forum for creating a research agenda using in the Clubhouse fashion, broad participation and consensus from Clubhouses. So we're working on what's the best format to help create and move forward our research agenda. Nikki, do we have time for one more, or should I do closing?
We do have one more. Have metrics improved Clubhouse marketing?
I would definitely say so, especially with just our grand opening for the Academy at Bradenton. Just being able to show our community our results and our outcomes. And I think that it's imperative that we kind of move away from just our average daily attendance and our average duration. Although those numbers are so important to us, we want to get more into what are we actually achieving? Who is achieving goals and socialization, and what does that actually look like, and making that measurable? Who isn't, who are, achieving those goals outside of the Academy in regards to various different dimensions of wellness, and making those goals measurable and being really intentional, and also making sure that we tailor those results to our audience. So who's coming in the building? Is it a donor? Is it a community partner? Is it a parent? Is it a potential new member? And what information do they want to see from us, and being mindful of that. So I think a lot of that too is being sure to have the results, capturing those outcomes, but also making sure that we are portraying it effectively to our various audiences that are joining us.
Thank you, Vanessa. I just want to restate how exciting this growing research collaborations and the resulting information that comes from these collaborations. I think it's fair to expect that we receive more strong evidence of Clubhouse effectiveness, and hopefully that leads to more Clubhouses in every community. I want to highlight just a few things to look forward to this fall. One is we have a psychiatric rehab journal that the program for Clubhouse Researches is coordinating, and it's going to feature several Clubhouse research papers. So we're really excited to see that. We have work ongoing with a data collection toolkit to provide every Clubhouse, and that resource will be put together in the portal. Information on what you might want to collect and how to collect it. It'll be a very comprehensive toolkit. We have lots of folks working on that we really appreciate. And then the last thing is we'll have research workshops at the World Seminar, and hope to see anyone interested in research at those workshops. We really appreciate all of your participation, to the panelists, to people who join this webinar, and to our hosts at IVCI. Thank you for helping to share this information. So I will turn it over to Nikki for closing.
Oh my goodness, thank you to all of our presenters today. If we have not answered your question, please send an email to wanawebinar@fountainhouse.org. The PowerPoint presentation and relevant links for today's session will be sent directly to everyone in attendance, and the recording will be made available in the next 1 to 2 weeks. Please take a moment to fill out the short survey that will appear once you leave the event. Thank you for joining today's webinar. Please be on the lookout for announcements regarding our future webinars.